Hey guys, Tony Maritato here. So this was an interesting experience that I thought, let me share it with the group so you guys know that we don't always have to do things the way things have always been done. So I'm sitting in the clinic. I've got my, what is today? Wednesday morning schedule. I had a little gap in the schedule, and during that gap, a patient came in to schedule. Now, normally what I do is I try to do the initial evaluation when the patient is here so that I don't send them away and then heaven forbid something happens and, we don't initiate therapy. So the patient came in. I wasn't planning on doing an initial evaluation. He was asking if we received the referral and other documentation, and I knew that we had. But what I did was I said, hey, I've got 15 minutes. Let me ask you a bunch of questions. Let me get the initial interview started right now. And then we've got another opening later this afternoon at 3:30. Why don't you come on back and we'll initiate therapy then? So face to face, we did the initial evaluation. I did most of my interview. I got past medical history. We got all of the information about what's going on, what makes his condition better, what makes his condition worse. I put all of my information into the computer. So now this same patient is going to come back this afternoon, and we're going to carry out the remainder of day one treatment. And so if you look at the Medicare guidelines, Medicare states that a treatment day might include multiple sessions. So in other words, the minutes that we did already will contribute to the minutes that we're going to do later today. I know that that's not a practical solution for mobile therapists, but don't forget, we still have access to telehealth, to concurrent video and audio. So what if you started with a telehealth initial interview, HIPAA compliant platform, video and audio concurrently, then you transition that into an in-person on the same day, or you did in-person initially, then you left, and then you followed up later that evening with the telehealth. A lot of times there are things that I want to see the patient doing in the home. Maybe I do a mobile visit in the home for a new patient. I set them up. I make sure that they have the technology so that they can literally push a button and connect with me through a telehealth platform. I do that before I leave. And then later that evening or that afternoon, if I want to see how they're doing with the exercises that I prescribed earlier in the day, I don't have to travel back out to their home. I can literally do it through the telehealth platform. It's still part of the same treatment day. So for the definition of a treatment day, look at CMS Chapter 15, Section 220, look at the definitions. But understand that the more creatively you can learn to manage your time and your schedule, the more effective you can be, the better the patient care experience, and the more profitably you can run your practice. Guys, if you have any questions, let me know. I'll catch you on the next video.